Hello beautiful people and welcome back to another video. My name is Sakshi Patel and I'm 5th year PharmD student. In this video, I'll be discussing one of our assignments that had been given to us in 4th year. This would be our drug utilization evaluation assignment, in which I had done an assignment on the usage of cephalosporins, third generation cephalosporins in medicine ward and in surgery. Okay, so you might be given a similar project or a similar assignment, or you might be not if you are someone who is in 4th year. Okay, but even if you are given DUR instead of DUE, then it would be performed in a similar manner, although a DUR is much simpler than DUE, which is what I'm going to show you. Now, if you have chosen to do DUE, then there are obviously 3 steps to do it. First one is you find out if you want to do it for a particular drug, or you want to do it for a particular ward, or you want to do it for a particular disease. Okay, that is, you select a particular drug on which you want to do it. As in, I selected third generation cephalosporin use. Now, cephalosporin, it is widely prescribed. That is the reason I narrowed it down to surgical ward and to medicine ward. You could do the same or you could not do the same. The other one is you could categorize it wise, or you could choose your topic from a particular ward, that is use of drugs in ortho ward, for example, or prescribing method in ortho ward, such thing. Or you could choose a disease, for example, drugs that have DUE on drugs used for breast cancer chemotherapy, DUE used for maybe arthritis. Okay, so you could select it that way, but the final analysis would be done in the similar way what I'm going to show. Is my, I hope this is being recorded. Okay, so this is my actual DUE project. I just had it, so I thought I would make a video on it to show you guys. So this I took on cephalosporin third generation usage in medicine ward and in surgical ward. Okay, so first we had to collect the data. So here is gender, age, diagnosis, comorbidities, drug 1 is route of administration, dosage and frequency, followed by the second drug which is in prescription, its route of administration, dosage and its frequency. Like that I did for each and every prescription and each and every drug. I wrote it down this way. Okay, now what happens is that for drug 1 I used the drug for which I was performing DUE. For my case it was cephalosporin third generation. Okay, so all the cephalosporin third generation that have been prescribed to the patient, they have been given in drug 1, and other subsequent drugs they have whichever have been prescribed, they are in drug 2, 3, 4 subsequently. All right, so now it does not matter whether the drug was prescribed generically or it was prescribed using the brand name. Nonetheless, it comes in here. Okay, so my total data or the sample size, it was 50, that is 50 cases. And yeah, this is how I did it. It could be of what do you say, yeah, medicine ward or surgical ward. This is what I collected and this is how I collected the data. Okay, now next comes its analysis part, and analysis part. This was all in sheet 1, as you guys can see here. The other part, that is the analytical part, it goes in sheet 2. Now in sheet 2 I had different tables made. First table is this one, as you guys can see. It is route of administration wise, route of administration, number of patients and percentage. Okay, so use of administration table, for that oral and IV was the main route of administration for my drug. Number of patients, so 34 patients out of 50 were given the drug orally, and 16 patients out of 50 were given through intravenous route. Percentage hence was 68% of the patients in medicine ward, they were given by oral route, and 32% of the patients, they were given cephalosporin by IV route. Next comes drug wise. So cefixime was given to 9 patients, total number were 50 patients, that is the sample size was 50 and percentage was 18. So here you can see that ceftriaxone is the most prescribed. It was given to 22 patients out of 50 patients, which total to 44%, followed by cefixime, followed by cefoperazone. okay, which was given to 8 patients out of 50 patients, and that totaled to 16%. Gender wise, if we see, then for males it was 30 patients out of 50 patients, which totaled to 60%, and for females it was 20 patient out of 50 patient, which equal to 40%. Next, I did it disease wise also. Now you will also have to do the same regardless of which drug you use, okay? So disease wise, percentage, if we see, then highest percentage it was given for liver disease, followed by stroke and gastroenteritis, followed by, yeah, respiratory tract infection also, then cardiomyopathy, acute febrile illness, and then AKI and epilepsy, jaundice, like that, okay? Then I have categorized it disease wise. So first I categorized it by route of administration, then how it was dispensed, that is the name, either it can be brand name or by generic name, then gender, then disease. Now we will see in age. So age wise, you cannot write a particular age and then the number of patient. It will be too cumbersome, too much data to analyze, okay? So we did it range, okay? So age range, less than 20 to 20 years, there were 3 number of patients who were prescribed cephalosporin third generation, which totals to 6%. Highest prescription was between 41 to 50 years of age. So 13 patients out of 50 were were prescribed with cephalosporin in the age group of 41 to 50, which totaled to 26%. Now you write the data like this in a table form, tabular form, that is, and then you create a chart like this, pie chart, okay? Now this pie chart is for route of administration. You can see oral and IV. Here it is. For oral it is blue color, for IV it is, I guess, maroon color, something like that, okay? And next we have chart for male and female. So the orange color indicates male and the blue color indicates female. Okay, next we have, this is number of patients who were given by the different names. Here it is, such as cefixime, cefotaxime, ceftriaxone. So this is the chart for that, and this one it is age wise chart. So here also you can see that 41 to 50 age range of patients, they have been prescribed with the most number of cephalosporins, okay? So yeah, this is how the analytical part looks like, or the evaluation part looks like, okay? So in sheet 1 I had all the data collection part, and in sheet 2 of the same Excel file I had the tabular form, and then it was represented graphically. Now the third part comes in, that you have to write your actual project. So this is how we write it. This is the introduction part. Okay. So what is DUE? It is a criteria-based evaluation of drug use that ensures appropriate use of medicine. So this is just, first I have written what is DUE, then I have written what is cephalosporin. That is kind of a justification of why I chose this particular topic. Okay, and this is also the mechanism of action. This is commonly prescribed diseases, what diseases it is commonly prescribed in, okay? And as you can see, this is Vancouver method of referencing, which I guess you will learn pretty soon. If you haven't, then there are different kinds of Vancouver method there are different kind of referencing. So this is Vancouver method, in which, for example, I have written here 1, right? So that means that paragraph or that line has been taken from this particular reference. Okay, so moving forward, yeah, so first part is introduction, then comes material and method. The retrospective observational study was conducted between January 2022 to February 2023. A total of 50 case records of patients were included. The prescription pattern was analyzed based on drugs, gender, route of administration, and age group. That is what all charts that I showed you, okay? So retrospective, because it's not that there are 2 kinds of studies. It can be either retrospective, or it can be prospective, or it can be cross-sectional. Okay, that is 3 types. Okay, so prospective is, for example, let's take patient A who has been diagnosed today, and today I take his file, and then I do a follow-up of him for whatever period of time he has been admitted in the hospital. For example, patient A has been admitted in the hospital for 3 months. Then for 3 months, starting from the day of admission, I have been taking his data. Then that is prospective. That is, I collect his data. I will be collecting his data in the future tense for the time being he is being admitted in the hospital. That is prospective collection of data. Retrospective collection of data is that the patient has already been discharged from the hospital, and after that I'm collecting his entire data. What diagnosis was there, what was his drug chart, medication history, his prognosis, whatever procedures were done to him, whatever surgeries he had gone to, everything. Okay, so if you collect the data that has been recorded in the future, in the past tense, that is retrospective. If you collect the data that will be collected in the future tense, then that is prospective data. Now cross sectional is that, for example, today I went to the ward and whatever patients were there, I took their today's vitals only. So that is cross sectional examination. Now this is a retrospective observational study. It is not interventional. So interventional is, it would be when I tell the patient that you should do this, or if I give a medication to the patient and I tell him that you have to take this for my research, then that is an interventional study. If I just observe whatever is being done to the patient or whatever the patient does, then that is observational study. No harm is done to the patient in observational study. Okay, so it is so my project was my assignment, it was retrospective observational study. That is, I collected the data that had already been collected. So this was the data which was collected from MRD, that is medical record room, and observational because I was not intervening in the patient's medication or in the patient's treatment. Okay, I was not telling patient to do something. I was not telling patient to take a particular drug or anything. Okay, I wasn't intervening in any way in the treatment of the patient. So that's why it was observational. I was just observing what the patient was being prescribed. That's why this study was retrospective observational. Okay, and the prescription pattern was analyzed based on drugs which I showed you, gender, route of administration, and age group. Inclusion criteria: patients prescribed with cephalosporin were included in the study. Patients with all the age group were included in the study. Okay. Exclusion, that is patient admitted apart from the general medicine ward, they were excluded. So all the other wards I did not take, that's why. Now result. Cephalosporin oral usage conducted for 68% and intravenous usage accounted for 32% of the total admission. So here, as you could see that I have written it for figure 1, that is this chart which we saw in the Excel sheet. Okay, so based on that I have written my result. So 68% were given by oral route and 32% were given by intravenous route. That I could analyze through the Excel sheet. Then next, so this was by route of administration. Next is gender. Then male patients were accounted for 60%, while female patients they were 40%. Next is, which you can see here in figure 2, which we already saw. Widely prescribed cephalosporin was ceftriaxone, that is kind of cephalosporin that was given. Okay, so 3. First was route of administration, then is gender, then is type. So ceftriaxone 44%. Most patients in age group 41 to 50 were 41 to 50 received cephalosporin, that is 26%. So this was our age range wise, followed by age group of 61 to 70, which you can see here in figure 3, age distribution of patient study. Next we have age distributions of Okay, so that one will be for majority of the hospitalized patients, they had liver diseases, that is 14%. Now this is based on diagnosis, followed by gastroenteritis, respiratory tract infections, stroke, 10% as primary diseases. Okay, here it is figure 5, which is disease wise distribution. So here you can see that 14% to liver disease, and then 10 to stroke, respiratory tract infection, which includes both LRTI, URTI, and gastroenteritis. That was my result section. Now coming to discussion, drug utilization studies, they were primarily conducted to encourage rational usage of drugs. These studies, they help us in understanding the target patients, the various indications, as well as the rationality of drug usage. Drug utilization study for antibiotics is essential because they are the most often abused owing to the wide therapeutic use. According to our study, ceftriaxone 44% was the most prescribed drug, which coincides with wide it being most prescribed drug in other similar studies also. So in discussion, what you do is that you take your study and then you take similar studies. You either take them through PubMed, Crossref, anywhere. So you take other studies also and you compare and contrast your study with other study results, and then you write whatever you understood from the result of your study and the result of other studies which is similar to yours. So that makes the discussion part. According to our study, ceftriaxone 44% was most prescribed, which coincides with it widely being most prescribed with drugs in similar studies also. In our study, most patients who had been prescribed with cephalosporin, they had liver disease, while in other study, that is whichever I compared. So I compared it to the third reference number, which is Drug Utilization Review of Cephalosporin in General Medicine Units of Rural Tertiary Care Hospital, published in 2012. So yeah, with other study, most patients, while in other study, most patients with cephalosporin prescribed, they had UTI. Okay. Okay. Okay, now comes conclusion. The study concludes that the third generation cephalosporin is widely used for treating. Okay, so coming back, conclusion. The study concludes that third generation cephalosporin is widely used for treating various liver, GIT, and respiratory tract infections along with stroke. From this study, we concluded that ceftriaxone was mostly used for specific therapy in general medicine ward. Oral cephalosporins are preferred over intravenous administration. So this is my entire assignment, which includes first of all Excel sheet. First Excel sheet in which I had collected all the data, followed by second Excel sheet in which I analyzed all the data, and third Word file, which was my final study, which had introduction, then material and method, inclusion exclusion criteria, result, discussion, result along with all the result graphical representation, also discussion, conclusion, and referencing by Vancouver method. Okay, now coming, wait, let me stop this. Alright, so coming to what were the difficulties that I faced while doing my assignment. First of all, it was topic selection. For my particular topic, there weren't much clashes because it was very much narrowed down. It was only for cephalosporin third generation and it was only for medicine board. Now, there were other classmates also of mine who had taken cephalosporin, but either they had taken all the wards or they had taken, for example, I had done it for medicine ward. So other person had done it for orthopedic ward, for onco ward, such. So there wasn't any clash with my topic and for others, but there were a lot of clashes with other people. For example, if someone took pneumonia, drugs prescribed in pneumonia and TB, at that time I think it was, I don't know what season it was, but yeah, it was from Jan. No, I don't remember, but pneumonia, right? So I think it was, between that monsoon to winter season, so there are a lot of respiratory patients also. So it was between that season that we had to select a topic. So many had taken respiratory ward, especially pneumonia or tuberculosis. Now pneumonia, TB, dengue, these three topics, they were most clashed. Okay, there were many people. I had started collecting my data, a lot of us had started collecting our data, and still the topics weren't decided for some others. So take care when you decide a topic, you just discuss it with your ma'am. And second thing is that first of all, you select the topic as fast as you can. Okay, you make the ward rounds in fourth year. In the starting, I guess 1 month, you will get an idea of what are the drugs that are commonly prescribed, what are the diseases that you can commonly encounter in your locality, and then you select a topic fast. Okay, then the second thing that you do is that you go on PubMed, Crossref, or any other site that you like, and you search for articles regarding your particular topic. Okay, and then you see that what information did they collect, what kind of data did they collect. For example, in mine, they all collected what kind of disease it was, the age range in which it was most commonly prescribed. So you have to collect the disease, you have to collect the age range, you have to collect the gender, the brand name with which it was prescribed, the dosage form which was most prescribed, or the route of administration, the dose at which it was given most commonly. So analyze what all data you will have to be collecting. Okay, so first comes topic selection, then comes data collection, that is analyze what kind of data that you need. Third is data collection. Also do this as soon as you can, okay, because collecting 50 patients, you might think that cephalosporin, although yes, they are most commonly prescribed medications in any hospital, but still for my particular case also, even in medicine ward, now medicine ward for any hospital, it is kind of a highly populated area, ward, okay. So but still I had difficulty collecting the data. I had difficulty finding 50 cases. I don't know why. Sometimes when you are looking for it, you don't get it. So that might happen when you go on to collect the data. So start collecting data with all your energy as fast as you can. Okay, select topic fast, analyze what data you have to collect fast, then collect the data fast. Okay, and then what you do is that you just have to put it into tabular form. And I won't suggest you that collect data today and then write it down in your Excel sheet today and then tomorrow again day wise. I wouldn't recommend it because I find it tedious and it consumes a lot of time. Instead, you could do it weekly, like in a week you could collect all the data and then you can put it in your laptop or wherever you want to put it. Okay, so weekly you can do it that way, and whenever you have reached your sample size, then you can analyze that. Okay, and meanwhile maybe you can also make a blueprint, or kind of a blueprint or a skeleton for my word file that I showed you. Okay, so the final, that booklet or whatever assignment, that pamphlet you have to give to them, so you can maybe create a blueprint for them or skeleton for that, and then you will just have to type out the data or the result you will have to type out. Okay, and also referencing, do not forget to do referencing very precisely, very nicely. Even if you are using a website, that's fine. You can find online tools which will cite your website. Okay, so you can also use that, but articles are more preferred, especially articles from PubMed, Crossref, Elsevier or Elsevier, I don't know how it is pronounced. So that is also very good site. So yeah, these are some of my tips, and I really hope that you guys enjoyed this video. And if you want any help for selecting the assignment topic, then let me know. I would be thrilled. And if you have any kind of problems then with the assignment, or if you want me to discuss just anything at all, then let me know in the comment section below, and I'm happy as ever to help. So signing off, this is Sakshi. I again hope that you liked the video, and if you did, then don't forget to like, share and subscribe to my channel. Bye bye, until next time.